Hi everyone, I am Dr. Peddi Rama Devi and I am an Ayurvedic physician. Today I would like to explain about PCOD. The polycystic ovarian disease is nowadays seen in most of the girls or women, and this seems to be more problematic in treating the women in the younger age as well as the women in the middle age. As such, we know that PCOD is a little bit complicated and it is a multi-hormone dysfunction. As far as PCOD is concerned, polycystic ovarian disease is concerned, most of the women are suffering with irregular periods and scanty periods or heavy periods. And the reason behind is a lot of women are stressed and they are having like sedentary life, and the lifestyle changes are more in women these days. Basically, PCOD is not only a problem, it is a multi-hormone problem. And most of the women, they have different symptoms like hair fall, irregular periods, and acne, and they have pigmentation problem, and some women they are landing up into obesity, and some have hirsutism, and all these are linked with different types of hormones in the ladies bodies, and as well as a lot of women are unable to express their problems. Basically they take it as a normal problem, but it is really a complicated problem. It is a long term problem. As per the modern science, as per the endocrinologist reports today, as per the scientific reports, it is said that it is a endocrine problem with birth itself. That is, it is a familial, like it is a genetic problem, it is said like. So most of the women who are suffering with this problem has to be very careful, and most of the women also are not able to change their lifestyles also. Maybe that is one of the reasons. And the signs and symptoms, as I said earlier, to certain extent they can modify with lifestyle. Mostly it is today as a lifestyle problem. We can consider it, because every 10 women, almost 2-3 women are suffering with this problem. So coming to the treatment aspects, Ayurveda do have a treatment. And for the part of the household tips, we can take certain tips as such, because most of the females try for adapting to natural methods, and out of that, like exercise is the best one, because most of the time what happens is this exercise relieves the stress hormones. So with the exercise, most of the women can manage their weight, because weight gain is one of the main symptoms. Apart from that, hyperinsulinemia is one of the major thing which is getting into the complexity of this PCOD. So hyperinsulinemia should be first one which has to be taken care. For that, what the woman has to do is that she has to change her lifestyle with changing the dietary habits. That is, they should not take more of carbohydrates. They have to switch into something with which are complex foods, like millets, and taking like mixed, that is, carbohydrates means direct carbohydrates they should not take. They can take like pounded rice, and they can take millets. They can take mixed millets and rice like thing, but not directly plain rice like thing. That is what we are getting these days, is a white rice, what we call it. So this is one of the aspects, and maintaining the insulin is very important, because the hormones are that is LH hormone is raised, and FSH is falling down. So there is a testosterone level increase, and insulinemia, hyperinsulinemia is taking, and growth hormone is also again disturbed there. So all these are complex. So naturally the women will be having different problems. So for that aspect, they have to maintain the bodily appetites regulating food habits. So for that they have to control, as I said previously, the carbohydrates and all. So apart from that, they have to take vegetables and raw vegetables and all, like carrots, beetroots, all these natural foods which we get these days. Those foods, if they are able to eat regularly, avoiding all these carbs and all, they can maintain the food habits. Apart from that, they should also stop taking outside junk foods like ice creams, cool drinks, snacks and all. And homemade food is the best food, and avoid oils and all. So oils also will increase the body fats and hormone levels. So for that, and regulating the menstrual cycle is the most important. For this, we have so many Ayurvedic herbs which they can help in their getting the regularizing the periods and all. So those are the some of the herbs like Ashoka, Shatavari, Lodra and Sariba, like thing. Those all should be taken with the doctor's guidance. Apart from that, again, stress factors has to be maintained. And if there is any other problem like kidney and all, they can take doctor's suggestion. And maintaining the regular cycles, maintaining the weight, and maintaining the stress levels will help the controlling, will help controlling the polycystic ovarian disease. Why? Because a lot of women are having this problem. So they just look at it as a simple problem. So most of the women, they don't even get for every 3 months also periods. So that is not the right way. Every woman has to get every month around 27 to 28 days, at least about 25 to 28 days cycle they have to get a period. But at least if she is a PCOD case, at least 35 days cycle also is accepted. But nowadays it's not that case. So it is coming to 9 months in a year. So when a woman does not have a periods for 9 months, then we can consider it as a not normal. And we have to go through the different investigations, just like ultrasound scans. If she's a married woman, transvaginal scans and hormonal assay. So with this, they can maintain the like regular cycles by taking proper treatment. But most of the women, like they just ignore it. Okay, this is fine, but it is not right. The weight management and all, they cannot do it. So they have to take some help from any nutritionist or any Ayurvedic doctor or any physician like thing. So basically PCOD is not a normal problem. It is a complex and complicated. So every woman has to make it a point that she gets regular periods, at least every 45 days for this PCOD cases. Mostly women come around 24 to 25 years and after marriage also they just hurry up for infertility. That is not the case. But as long as a woman in a PCOD case gets regular periods, she may have a chance of going for fertility. Like she may have no botheration about fertility. But still, like it is a caution that PCOD may land up into infertility. So in all cases, it is a vicious circle, and women who are having PCOD should have guidance, should take proper doctor's treatment, and after treatment also follow-up should be there. And when she is normal, whenever she has irregular periods, again she has to meet a doctor and get the things done.